University's Langone Medical Center. Dr. Goldberg, good morning to you. When we hear non-compliance, denied a transplant because of non-compliance, is there one set of guidelines for all of these transplants?
There is one set of guidelines for all transplants. First, it's medical, to make sure the person is healthy enough, that they have good functioning kidneys, a normally functioning liver, don't have alcohol or drug abuse, and are healthy enough to go through the procedure. The procedure, we have the technology to do the procedure. That can be done pretty easily. All you need is a heart.
But then when you hear this family say they're concerned that perhaps this is something other than about a medical concern, this could be because of run-ins with the law. Is that something that the board overseeing a transplant would consider?
Not necessarily the fact that the person has been in trouble with the law, but we do worry about people who fail to be compliant or are able to follow through the program after transplant.
But if you have had run-ins with the law, would that place you in a lower spot on the transplant list?
Not necessarily. What places you on a lower part of the transplant list is evidence that you haven't followed through with taking your medications in the past. Research has shown is if you fail to take your heart failure medications before the transplant, you're unlikely to take them after.
This is life and death for a patient. This is the world for that patient's family. If they feel they have been judged wrongly in this and that they haven't been given the right consideration, what avenues are left open to them?
I think there has to be better communication between the medical personnel and the family. Certainly they can always go for a second opinion. At another heart failure.
Can they appeal the decision?
They could appeal the decision to the ethics committee of the hospital, and that could be decided with the ethics committee of the hospital. It sounds like the one thing this young man has going for him is a really committed family, and that also counts with someone who's on the transplant list.
All right, Dr. Nisa Goldberg. Doctor, thanks very much. I appreciate your input. When we come back, some never before